Hi, I'm Nicholas Fogelson from Northwest Endometriosis and Pelvic Surgery. It's rather dark in my office because it is the apocalypse out there. We have incredible forest fires raging outside of Portland, and it's unfortunately getting pretty close to the city as well. But for now, I'm here in my office working, and things seem okay for the moment. But if you look outside, it's very dark and dreary and smoggy. But I recently posted online, I said, I don't know what to talk about anymore. I've talked about so many things in endometriosis, like what do people want to know about? And sure enough, within just a few minutes, we have lots of questions. So I wanted to touch base on some different questions and try to get in depth on them a little bit. And so from time to time, I'll make a video to address a question. And if I didn't get to yours, hopefully I'll get to it one day or sometime soon. But let's talk about adenomyosis a little bit. So there's a couple questions about that. So adenomyosis is a condition where the lining of the uterus is growing into the wall of the uterus. And in order to understand what that is, we got to understand what the uterus is. And the uterus is kind of like a layer cake where the outside is like a skin. It's called a peritoneum. And it doesn't do much. You can get endometriosis on it, but otherwise the outside is just sort of this clear skin. And it's called a visceral peritoneum because it's stuck to the uterus. And then you have a big, thick layer of myometrium, which is uterine muscle. This is just big, thick layers of smooth muscle. And if you look at them under a microscope, you literally just see seas of tiny little smooth muscle cells. And that's the big layer of the uterine muscle. And when you have a menstrual cycle or some other reason for the uterus to contract, what's contracting is those smooth muscles are shortening. And so the whole uterus is contracting in like this and pushing whatever's on the inside out. And that's also what causes the baby to come out, is the smooth muscle of the uterus contracting to push the baby out. So there's that serosa, then there's smooth muscle, and then you have what's called the endometrium. And the endometrium is like another layer cake. It has a basal layer, which is a basement membrane that goes under between the muscle and the endometrial layers, and we sometimes call it the stratum basalis. And then you have another layer of glandular cells, which are what we call the proliferative part of the endometrium. And that glandular layer, every single month, responds to hormones and gets very, very thick, and then it sloughs off during a menstrual cycle, assuming that a woman doesn't get pregnant. And that's what a menstrual cycle is. So you have that layer of proliferative uterus, endometrium, basal endometrium, myometrium, and then peritoneum or serosa. So the best way to think about adenomyosis is that these layers are getting kind of mixed up. It's almost like you had this perfect layer cake and someone came in with a spoon and scooped a bit out, and those layers started to get messed up. Maybe you had a little bit of jelly in there, and now the jelly is kind of in with the cake. And effectively what it is the endometrium is getting mixed into the muscle part of the uterus. When that happens, because the endometrium bleeds every month and it swells, what happens is when you have endometrium within the muscular part of the uterus, you basically are getting bleeding and inflammation that is stuck in the muscle of the uterus, and it can't get out, and it's causing the uterus to contract, it's causing the uterus to hurt, and in many cases it causes the uterus to hypertrophy, to where the muscle part of the uterus gets very, very thick, and you start getting mixed in muscle cells and glandular cells. So again, that layer cake is all mixed up, and now you've got that inner layer and the middle layer all mixed up together. And then over time, that middle layer gets thicker and thicker and thicker because it's a layer of muscle along with a layer of endometrium. And that's what adenomyosis is. Sometimes you can even get a big ball of almost all endometrium within the muscle, and we call that an adenomyoma. It almost looks like a leiomyoma, which is a uterine fibroid. And those are very painful. Adenomyosis is very painful. A good way to think about why adenomyosis develops, because most adenomyosis is developed after women have had children. There are cases of congenital adenomyosis, which is probably very similar to endometriosis, where literally the lining of the uterus is growing in the muscle of the uterus, and it was probably that way since the person was born. But most adenomyosis seems to be after people have had kids. And the reason why is because the placenta is actually an invasive organism. It has a lot of genetics in it that are very similar to invasive cancers. And when the placenta grows, if this is the uterine wall along with some layers of endometrium, the placenta will just stick on there. And then using the same genetics as cancers, which invade other tissues, the placenta will literally eat a hole into the wall of the uterus So now my wall of the uterus is like this, and literally there's a hole, and the placenta is fused to the uterus. It's not just like, here's the wall, the placenta is just sticking here. Literally, there's like a cave made in the wall of the uterus, and the placenta is fused in there, and you cannot get it off. And it doesn't start coming off till after the baby's born. Now, there's something called a placental abruption in a pregnancy. That's when the placenta does start to rip away, and it's life-threatening for the baby and for the mother. So it doesn't really happen very often. The reason why it's so stuck is because basically the mother's blood vessels and the baby's blood vessels, which is the placenta, become intertwined to where rather than just being two separate things, basically the baby and the mother become one thing. And the placenta is part of the baby. It comes from the baby. It doesn't come from the mother. And so effectively the baby and the mother at that point become one organism. And so you have to imagine that we've cut a hole. It's like you've taken a couple of big scoops out of this layer cake, and then you took this thing and put it in the hole. And then that thing fell away, and now you have a big hole there, and now you're going to let all those layers regrow. So think of it also a little bit like if you were to dig a big hole in a lawn. If you were to let it regrow, you could imagine that it would not be really orderly in the way it would regrow. And so when you cut this big hole in the uterus, or you cut a big hole in your lawn, if you let the grass regrow into that hole, it's not going to look all orderly like the rest of the lawn did. And the endometrium on the inside of the uterus, similarly, as it tries to regrow and basically recarpet that divot in the uterus that the placenta made, it will start growing into the wall of the uterus. And I think basically every woman that's ever been pregnant will have some amount of adenomyosis. If you were to look microscopically at what's going on in the uterus, there's probably some amount of adenomyosis in everyone that has had children. The more children you've had, the more of these divots and craters have been dug into the wall of the uterus, and the more opportunity there has been for the endometrium and the myometrium to get all mixed up as it heals. And so some women that have had 3 or 4 babies may have a uterus that has a lot of adenomyosis in it. And that's usually how adenomyosis happens. So adenomyosis symptoms are people have really painful bleeding. They can have painful intercourse sometimes. They can have very heavy bleeding. So endometriosis doesn't usually cause heavy bleeding, but adenomyosis does cause heavy bleeding because the uterus is big. It's bringing more blood supply to the uterus, more blood's coming in, more blood's coming out. And so adenomyosis does have those symptoms. If a woman says, I'm bleeding for 7 days during my cycle, and it's really heavy, and I have to use multiple pads, and she says I've had 3 or 4 kids, first thing on my mind is she probably has adenomyosis. Sometimes people get confused and they think that bleeding abnormalities are coming from endometriosis, and generally they do not. Endometriosis generally doesn't cause you to bleed more heavily, doesn't cause you to bleed irregularly, but it does cause you to bleed more painfully. But the actual amount of blood and the scheduling of the bleeding generally doesn't have anything to do with endometriosis. So what can you do about adenomyosis? Again, like everything, there's medical therapies, there's surgical therapies, and then there's the do-nothing therapy. I always say you have a lot of options. We can use medicines, we can do surgery, or we can just do nothing. Most of these things are not life-threatening, so doing nothing is always an option, but usually by the time a patient or a woman comes to a physician, they want to do something. That's why they're there. So medical therapy for adenomyosis can be birth control pills, it can be progesterone, but really the thing that makes the most sense for medical therapy for adenomyosis is to put a progesterone IUD inside the uterus, because the problem is in the lining of the uterus. So getting that progesterone right inside the lining of the uterus with the IUD is like the perfect medical therapy for adenomyosis. And a lot of women will significantly benefit from that. And there's lots of women that have kind of mild to moderate adenomyosis and they have an IUD and they do fine. If that doesn't work, then I usually would recommend a hysterectomy, assuming that a woman is done with childbearing. If she's not done with childbearing, then a hysterectomy is often not an option. But if she's done with childbearing, I'd recommend a hysterectomy. There's a variety of things that can be done to try to treat the lining of the uterus, but all of those things make the uterus no good for having kids. So they're already damaging the uterus. And a minimally invasive hysterectomy is so straightforward now that we can do it with 3 or 4 or 5 millimeter holes in the belly, and then the uterus comes out through the vagina. And a relatively typical hysterectomy takes me an hour or less. And people recover very quickly and go home the same day, and almost zero complications in skilled hands. So, like, I'm not that interested in doing surgeries that are maybe not going to work. Whereas a laparoscopic hysterectomy for the purpose of adenomyosis has a 100% cure rate. I mean, you're going to completely remove the adenomyosis problem. For women, and so that's usually what I'm going to recommend. Now, for women that want to preserve fertility, that's another story. I mean, usually you're going to try medical therapy until you're really ready to have kids, and then get off the medical therapy, because any medical therapy is contraceptive. So get off the medical therapy, get pregnant hopefully, and then maybe address the adenomyosis later. Sometimes people recommend, just for the pain of adenomyosis, people talk about doing a presacral neurectomy. That's a whole other topic which I could talk about another day. But a presacral neurectomy interrupts the sensory nerve supply from the uterus, so uterine pain can be substantially better from a presacral neurectomy. Not to get too deep into it, but it also interrupts blood supply to other organs as well. It doesn't come for free. Those nerves were there for a reason, and if you cut nerves that were put there for a reason, you're going to suffer the consequences of having removed a part of your autonomic nervous system. But that's an option, doing presacral neurectomy. So I hope that's interesting and useful information about adenomyosis. I appreciate the great amount of information or questions that people have given, and it gives me a lot of ammunition of things to talk about. I always like to try to educate and give people information. So thanks for asking the questions. Feel free to throw more up on there. And talk to you soon. If you have any would like to get in touch, our office number is 503-715-1377. And we're actually moving to a new office. We'll be in our new office in about 6 weeks. It's under construction. And look forward to seeing people here in Portland. And hopefully the skies will be clear and not too much of the city has been burned down. Fortunately, the fire is still in rural outside Portland, but you never know. There's been a number of communities here in Oregon that are ashes right now, which is pretty horrible. But anyway, other than that, have a great day.